Next speaker is Mr. Thulasiraj, and he's going to be sharing with us the Arvind concept of self-sustaining community eye hospitals.
Please unmute yourself.
Yeah, I have unmuted. Okay, yeah. You can hear me now?
Yes, sir. Please
And
put on
see
slideshow,
the
sir.
slide. Okay, good. So I have, I guess, 10 minutes, right? So when people talk about sustainability, I think they largely focus on the financial aspect. But I think we need to take a much more comprehensive or a holistic perspective to sustainability. It has to also include human resources, leadership, demand being relevant, and also I've added environment. So I'll be touching on each of these aspects, less so directly on financial, because I think you recognize that it cuts through the entire, all the points. And I'll dwell a little more on the environment part of it. So all of us recognize that our organizations depend a lot, almost entirely on the human resources. Now, we often face one of these challenges. Either we don't have the right numbers, or we don't have a pipeline for meeting attrition or growth, around talent, competence, motivation, being nice to patient, etc. So the approach that we have taken to address this, which addresses pretty much all of those concerns, is to develop a robust internal pipeline. So this is just an example of the mix of staff who are full regular employees versus those in the training. The trainees are essentially the pipeline. So they are in training for 2 years or 3 years, which gives us adequate time to build competence, build the right values, right attitude, and all of that stuff. So since we are a fairly large organization, we have the scale to do this in a very different way, having our own training kind of an engine. But even smaller hospitals can really adopt this method of having internship and those apprenticeship. There are very many options. And we have found this to be a win-win situation in the sense that those in training get a career, they get a job, so their own life improves. And for the hospital, we're assured of a HR supply line. And since all of this, since the trainees also work with patients to develop the skills, etc., indirectly it also ends up costing us less on the HR front, and this is found to be a sustainable solution. So for the last maybe a couple of decades, we've had very little lateral entry, and all the staffing happens through the internal pipeline. And another aspect when it comes to HR and to sustain is to really make sure that the staff are used well. The reality is that the salaries that we pay are pegged to competence. The doctors probably account for almost half your wage bill. And then it also is true that those highly competent people are also the bottleneck in the organization, in a positive sense, in the sense all care has to go through them, so their productivity or how much they produce determines the output of the organization. So as a result, we need to kind of make sure that we never underutilize a person. So we do a lot of tasks in a very systematic manner. Essentially, one person does one task, sometimes two, at any given point of time. They're often rotated between tasks. So with the result, high skill development and good quality also happens in whatever they do. And it also results in effective equipment utilization. And all of this significantly reduces cost and increases throughput, which also has a financial bearing. Now next aspect, which is uh, if you take the continuum of care, there are people who want to seek care, if they can manage to come to the hospital, be diagnosed, and if they comply, we're able to provide treatment. But unconsciously, most of us have put our boundaries as treating those who come to us, that is diagnosis and giving a treatment advice. And then those who are able to comply, we provide the treatment. So we're kind of limiting our boundary of what we do and what we don't do. And then one proposal I'm making is that if we can shift the boundaries to go to the community level to make sure that everyone who needs care is enabled to come. And everybody who's advised is enabled to undergo the treatment. And then once you do that, I think the demand becomes more robust. And the other aspect is to kind of design to close the loop. If you're running a vision center, make sure that they're able to get the medicines and the glasses, locally. Otherwise, all that is the point of time goes waste, because prescription never makes a patient better. So this is about plugging a lot of the leakages, from getting from the patients from the community into the system. Are we advising them appropriately? And those advice, are they getting the surgery or not? And then once we intervene, is the outcome what it should be? So once we're able to kind of close this whole loop, the demand gets much better, because I think the outcomes become better, which reinforces demand. So this approach really is a win-win, in the sense the patient gets better, and then the hospital will have more patients, and then that translates to top line, bottom line revenues and surplus. And this I believe is what sustains and grows the demand over time. On the other aspect of sustaining is that we have to remain continually relevant, to the needs of the community, which requires at one level looking inward, looking outward with benchmark, and then continually improving what we do. And this requires building a culture of learning. You're building a culture of humility that recognizes that you don't know it all at individual level and at organizational level. And then the leadership also has to keep a tab on what's happening outside, not just in ophthalmology or eye care. For that, I think it happens automatically, but also what makes eye care happen. On the technology front, Dr. Rao mentioned a lot about harnessing information technology to do. So all of that has to happen to stay relevant, and that's a very strong leadership role. I'm going to spend a little more time on the environmental sustainability. But I say this because healthcare is a significant polluter of the carbon footprint, and we threaten the sustainability in a significant way. In the developed countries, almost 10% of the carbon footprint is accounted for by healthcare. Fortunately, in developing countries, it is less, but we might catch up. So when it comes to resources, we have developed a model to address this. Now, with infrastructure, we kind of go for green buildings, reduce energy use, or go for renewable energies. I'll give some examples. Significantly reduce the resource need, like EMR completely reduces the need for paper, standardization, reuse, multi-use, recycling, and then the way you design the services, your processes and practice again have a huge impact on reducing or increasing the carbon footprint in terms of service design, equipment maintenance, how you procure your supplies, your clinical protocols, and so on. So just for example, we kind of monitor and do like a one-stop, one visit service. Like if a person comes into the hospital, I mean, they kind of go with the solution, in their hand. If it is surgery, we don't have any waiting list, so they can get operated the following day, and so on. And similarly, if it is glasses, 85 to 90% of them are delivered on the same day, which means they don't make multiple trips to get glasses. All of that reduces carbon footprint as well as the cost to the patient. On the energy front, we have switched significantly into green energy or getting into purchase arrangements from solar and wind energy suppliers. These are not our assets, but then over 80% of our power today is through renewable energy. And as a result of just the green energy, we're saving about 10 lakh rupees a month. And then by also going through methods of energy reduction, we have another 20 lakhs, roughly 30% saving on the energy bill. Also water management, we have an organic water treatment plant which treats about 20 lakh liters a day, and also rain harvesting, reducing water usage, and so on. Having very lean protocols. As a result, the waste from our surgeries tend to be about 5% of what is in the Western world, US or UK. So in conclusion, your focus on environment also makes sure that the community or the patients get the care more efficiently at a lower cost. And for the hospital also, you have the caregiving, we get more patients and also at a lower cost. And then we're also reducing the carbon footprint. So I feel that we have a new kind of opportunity now, which really creates a triple win. Make sure that all involved are benefiting by this. Thank you.
Thank you very much. I think the way to go is to be more sensitive towards the environment, because if we would have been more sensitive, probably we wouldn't have landed up in the pandemic issue also. And thank you very much.